Could you be taking a medication that seems harmless, but is actually increasing your risk of a heart attack, stroke, or heart failure? And more importantly, did you know that this risk goes up dramatically if you're over 50, have high blood pressure, high cholesterol, or a history of heart disease? Welcome to Age Stronger, the channel where we share clear, practical, and easy-to-understand medical advice created specifically for older adults. I'm your doctor today, and together we're going to uncover some crucial information that very few people ever tell you about. These are the kinds of insights cardiologists wish every person over 50 knew earlier, and today you're going to hear all of it. Why can a simple cold medicine cause a sudden spike in your blood pressure? Who should avoid hormonal birth control once they're past 50? And how can you protect your heart even if you still need to stay on certain medications? Before we dive into the details, don't forget to like this video, share it with your loved ones, and subscribe to Age Stronger so we can keep creating high-quality content to help you and your family live healthier every day. Now, let's get started. 1. Combined hormonal birth control, a tiny pill with a big risk for the heart. Have you ever considered that the birth control pill your daughter, granddaughter, or even you yourself once took might be quietly increasing the risk of a heart attack? As a physician with nearly 40 years of experience treating older adults with heart conditions, I've seen more cases than I can count where otherwise healthy women landed in the ER with a heart attack, and the culprit wasn't high cholesterol or diabetes, but something more unexpected: combined hormonal contraceptives. These are known as CHCs, and they include forms like the pill, vaginal rings, and patches. They work by delivering synthetic estrogen and progestin into the body to prevent ovulation and alter cervical mucus and the uterine lining, highly effective for birth control. But here's what's often left out of the conversation. Estrogen significantly impacts the body's blood clotting process. What many don't realize is that synthetic estrogen in birth control can increase clotting factors like fibrinogen and factors Roman 7, Roman 8, and X, reduce natural anticoagulants like antithrombin Roman 3, promote chronic hypercoagulability, especially with long-term use. So let me ask you, if you knew a small pill could silently promote clot formation in your arteries, would you still call it safe? And the risk goes even higher for women who smoke even occasionally, have high blood pressure, have elevated cholesterol, are over the age of 35. A large study in Denmark that followed over 2 million women aged 15-49 found that those using estrogen plus progestin pills had a 2x higher risk of heart attack and stroke. Those using vaginal rings had a 8x higher risk of heart attack. And these risks existed even without prior heart disease or diabetes. Now consider what happens when additional risk factors are present. The dangers multiply, sometimes catastrophically. Not all birth control is the same. There are 3 main types: combined pills, estrogen plus progestin, oral, moderate cardiovascular risk; vaginal ring or patch absorbed through mucosa/skin, higher cardiovascular risk; progestin-only methods, injections, implants, EUD, lowest cardiovascular risk. Estrogen is the key driver behind clotting and cardiovascular issues. That's why, before prescribing, I always ask myself, does this patient have other underlying risks? Is there a safer contraceptive option? And if a patient has any of the following, I absolutely avoid estrogen-containing methods: over 35 and smokes, history of stroke or heart attack, valvular heart disease, atrial fibrillation or heart failure, on blood thinners, uncontrolled hypertension greater or equal to 160/100 mmHg, history of DVT or pulmonary embolism, obesity, class Roman 2 or Roman 3. Do you or someone you love fall into one of those categories? If so, it's time to talk to a doctor about safer alternatives. Safer options for women at cardiovascular risk include levonorgestrel IUD does not increase clotting, subdermal implant, e.g., Implanon, progestin-only daily pills, barrier methods, e.g., condoms, safe, non-hormonal. 2. NSAID, the everyday painkillers that may secretly harm your heart. Even people with known heart conditions are regularly using NSAID. Medications like ibuprofen, diclofenac, or naproxen daily, weekly, for months at a time because, frankly, it helps with the pain. But after nearly 40 years of treating patients with heart disease, I can tell you this. Relieving pain today can sometimes mean risking a heart attack tomorrow. NSAID, short for non-steroidal anti-inflammatory drugs, are widely used for joint pain or muscle aches, dental pain or headaches, reducing inflammation or fever. They work by blocking an enzyme called cyclooxygenase COX, which your body uses to make compounds called prostaglandins. These prostaglandins don't just cause pain and inflammation. They also help blood vessels dilate, stay open, protect the heart, kidneys, and stomach lining, reduce blood clotting by preventing platelets from clumping too easily. So when you take NSAID, especially in high doses or for extended periods, you're not just numbing inflammation. You're also disrupting the balance between vessel dilation and constriction, the control of clot formation and breakdown, blood flow to your heart and vital organs. The result: an increased risk of blood clots, heart attacks, and strokes. Both the FDA and several European studies have shown that the risk of heart attack from NSAID can appear within just a few days of use, especially when taken in higher than recommended doses, used for more than a week continuously, used by people with a history of heart disease, diabetes, or high blood pressure. I once followed a study at a heart hospital where patients were prescribed diclofenac 50 mg twice a day for 10 days straight to treat joint pain. What we found was concerning. In many patients, this specific NSAID triggered vasoconstriction and thrombus formation, meaning their heart vessels were literally tightening and clotting. That's a setup for a heart attack. Not all NSAID are created equal. This is crucial. Different NSAID carry different risks. For example, diclofenac has a very high cardiovascular risk, comparable to certain selective COX-2 inhibitors. Ibuprofen carries a moderate risk, especially as dosage increases. Naproxen appears to have the lowest cardiovascular risk of the traditional NSAID. COX-2 inhibitors like celecoxib, very high risk, particularly in higher doses. The FDA has issued official warnings that all NSAID, even those sold over the counter, can increase the risk of heart attack or stroke, especially when used long-term or in individuals with pre-existing heart disease. What's even more alarming, these risks apply even to otherwise healthy people if the medication is misused or overused. Why are seniors more vulnerable? As we age, our blood vessels lose elasticity. Our risk of conditions like high blood pressure, high cholesterol, or diabetes increases. The kidneys, which help clear medications from the body, don't work as efficiently, so drugs like NSAID build up more easily and stay in our system longer. When should you absolutely avoid NSAID? Based on both my experience and guidelines from heart organizations, I advise my patients not to use traditional NSAID if they have a prior heart attack or stroke, a history of stents or bypass surgery, congestive heart failure or chronic leg swelling, uncontrolled high blood pressure, chronic kidney disease GFR 60, are taking blood thinners like warfarin or apixaban? Are older adults taking multiple medications? Safer alternatives to NSAID. Not everyone needs NSAID, and in many cases, there are safer, smarter alternatives. Here's what I recommend depending on your condition. Acetaminophen, Tylenol, best for mild pain, with minimal cardiovascular effects. Topical anti-inflammatory gels or creams useful for localized joint or muscle pain. Heat or cold therapy works well for chronic musculoskeletal pain. Low-dose opioids short-term use only and always under close medical supervision. Naproxen if NSAID must be used. Naproxen in the lowest effective dose for the shortest time. Proton pump inhibitors, PPI, like omeprazole, may be used alongside NSAID to protect the stomach in older patients. Take a moment to reflect. Let me close this section by encouraging you to pause and ask yourself, is someone in your family taking painkillers daily without realizing the risks? Has your blood pressure gone up recently? And could it be linked to a painkiller you thought was harmless? Have you had your heart checked while on NSAID? If you have concerns or stories to share, drop them in the comments below. Your experience could help save another life. 3. Rosiglitazone, a diabetes medication that could be flooding your heart with fluid. One of the clearest examples is a medication called rosiglitazone. Once praised for improving insulin sensitivity and controlling blood sugar, it later raised serious concerns when studies and clinical experience revealed that it could actually cause the heart to retain fluid, place stress on the cardiac muscle, and lead to heart failure if not used carefully. Especially in older adults, rosiglitazone belongs to a class of medications known as thiazolidinediones, or TZD. It works by activating something called PPAR, gamma receptors in muscle and fat cells, helping them respond better to insulin. It's effective at lowering blood glucose and typically doesn't cause sudden drops like insulin or sulfonylureas might. Sounds like a good deal, doesn't it? But here's the catch. This medication can cause your body to retain salt and water, alter your lipid fat metabolism, and increase the overall volume of blood in your body. That forces your heart to pump harder, and if you already have a weak heart or are over 65, that extra burden can push it to the brink. Have you ever gained 2-3 pounds in just a couple of days without changing your diet? Have your shoes ever felt tight because your legs were swollen and you just blamed it on the heat? Have you ever considered that it might be the diabetes medication you're taking? In fact, back in 2007, a meta-analysis published in the New England Journal of Medicine found that patients on rosiglitazone had a 43% higher risk of heart attack. The risk of heart failure also increased, not always resulting in immediate death, but certainly compromising quality of life and long-term outcomes. What's especially dangerous is how quiet the symptoms can be: fluid buildup, rising venous pressure, and progressive heart failure don't always hit you like a truck. Sometimes it's just a little breathlessness here, some swelling there, until one day it becomes an emergency. If you're over 65 or have ever had heart failure, a heart attack, or even mild kidney dysfunction, then rosiglitazone could pose a much higher risk. That risk goes up further if you're taking beta blockers, have obesity, are postmenopausal, or live a sedentary lifestyle. Now, if you or someone you love is currently taking rosiglitazone, it's absolutely worth speaking to your doctor about safer alternatives, especially if there are any signs of heart strain. Here are some more heart-friendly options available today. SGLT2 inhibitors like empagliflozin or dapagliflozin, which not only lower blood sugar but also lightly reduce fluid overload and protect the heart. GLP-1 receptor agonists like liraglutide or semaglutide, which aid in weight loss, blood sugar control, and reduce the risk of cardiac events. Metformin, still the gold standard for type 2 diabetes and generally safe for the heart. DPP-4 inhibitors, which help regulate blood sugar without stressing the cardiovascular system. If you're currently taking rosiglitazone, I urge you to be vigilant for early warning signs like rapid, unexplained weight gain 2-4 pounds in a few days, swelling in your feet, ankles, or legs, shortness of breath when lying down, fast or irregular heartbeat, or chest tightness with exertion, decreased urination, or needing to urinate multiple times at night. If any of these show up, stop the medication and call your doctor immediately. Do not self-medicate with diuretics unless instructed by a healthcare provider. Ask for a cardiac evaluation, including an ultrasound or an assessment of heart function. Before I wrap up, let me leave you with a few final questions. Do you know the name of the diabetes medication you take every day? Has someone you know started retaining fluid or experiencing swelling after beginning a new diabetes drug? Have you ever asked your doctor, is this medication helping or hurting my heart? If you're not sure, or if this raised any concern, drop your questions in the comments. Either I or someone from our clinical team will do our best to help explain what you need to know in plain language, and just like we would to our own family. 4. Antidepressants and the aging heart. When treating the mind affects the beat. Let me speak plainly to you, especially if you're over 60 and currently managing depression or anxiety. Did you know the very medication helping your mood might be silently affecting your heart's rhythm? It's more common than you might think. Many older adults come to my clinic complaining of strange heartbeats, dizziness when standing, fatigue, or disrupted sleep. And more often than not, part of the problem can be traced back to the antidepressants they are taking, medications they trust, medications they may have been on for months or even years. Over the past 3 decades, I've treated dozens of older patients who developed fatigue, arrhythmias, or episodes of fainting linked directly to their antidepressant medications, particularly from 2 main classes: tricyclic antidepressants, TCA, and selective serotonin reuptake inhibitors, SRI. Let's start with TCAs, names like amitriptyline or nortriptyline. These used to be the gold standard for treating depression and are still sometimes prescribed today, especially in older patients, often not for depression but for chronic nerve pain, fibromyalgia, or insomnia. But here's the problem. These drugs carry a heavy cardiac burden, something seniors need to be very aware of. TCAs can slow the heart's electrical signals, prolong critical intervals on an ECG like PR, QRS, QT, and dramatically increase the risk of life-threatening ventricular arrhythmias. They also have what we call anticholinergic effects, which can cause a racing heart, dry mouth, difficulty urinating, cognitive confusion. They also impact alpha receptors, leading to orthostatic hypotension, a dangerous drop in blood pressure when standing up, which greatly increases the risk of falls and brain injuries. Now let's talk about SRI like fluoxetine, Prozac, sertraline, Zoloft, or citalopram, Celexa. These newer antidepressants are considered safer for the heart than TCAs, and they generally are. But they are not completely risk-free, especially for older adults. Take citalopram and escitalopram, Lexapro, for example. These can prolong the QT interval, a measure of how your heart resets between beats. If that interval gets too long, it can lead to a rare but dangerous type of arrhythmia called torsades de pointes, which can cause fainting or even sudden death. And in older adults, especially those over 60, even moderate doses, like over 20 mg/day, can trigger this effect. Depression in older adults is very real. It can be brought on by the loss of a spouse or loved one, declining physical ability, chronic pain or insomnia, loneliness and social isolation. Treating it is essential, but choosing the wrong medication or failing to monitor heart effects can quietly wear your heart down. Now, I'm not saying you should stop antidepressants just because they might affect your heart. Not at all. Mental health is just as important as heart health. But in older adults, we must individualize treatment and monitor closely. Here's how I usually approach this in practice. I start with low-dose SRI first and always schedule an EKG within the first 2 weeks. I avoid TCAs in anyone with a history of fainting, irregular heartbeat, low blood pressure, or those on multiple medications. If TCAs must be used, like for resistant nerve pain, I combine them with heart protective strategies and regular heart monitoring. I never combine SRI with other drugs that also prolong QT intervals, like certain antibiotics or antiarrhythmics. Every 3 to 6 months, I reevaluate, asking directly about dizziness, fatigue, skipped beats, or new shortness of breath. I always ask my patients, in the past week, have you ever felt dizzy when standing up? Have you noticed your heart skipping, racing, or beating irregularly? These little details often reveal the earliest warning signs of antidepressant-induced cardiac issues. Your mind and your heart are deeply connected, and what helps one can sometimes strain the other. But with careful choices and attentive monitoring, you can have both emotional wellness and cardiovascular safety, especially in your golden years. 5. Pseudoephedrine, a tiny cold pill that could be a big problem for your aging heart. If you're over 60, especially if you've been diagnosed with high blood pressure, coronary artery disease, or have a history of heart rhythm issues, then I need you to pay close attention. That tiny over-the-counter pill you thought was just a simple decongestant may be silently overworking your heart. I'm talking about pseudoephedrine, a common decongestant found in many cold, flu, and allergy medications. It works by stimulating alpha-adrenergic receptors, causing blood vessels in the nasal passages to constrict. That's why your nose clears up. It reduces swelling in the lining of your sinuses. But here's the other side of the story. Pseudoephedrine doesn't just constrict blood vessels in your nose, it can constrict all over your body. That raises blood pressure, accelerates heart rate, puts stress on the heart muscle, and increases oxygen demand in your heart. For younger, healthy people, that might not be an issue. But for older adults with already weakened hearts, narrowed arteries, or disrupted electrical signaling, this added burden can be dangerous, even life-threatening. Let me put it this way. That small pill that helped you breathe through your nose could end up putting you on a ventilator if you're not careful. One of my patients, a 66-year-old man with a 15-year history of hypertension and a coronary stent placed 2 years prior, experienced exactly that. He caught a mild cold one winter morning, just nasal congestion and a sore throat. Thinking nothing of it, he bought an over-the-counter cold medicine from the pharmacy. It contained pseudoephedrine, 60 mg per dose. By the time he'd taken the second pill, he noticed his heart was racing, 110 to 120 beats per minute. He felt chest tightness while walking and dizziness when standing. His family rushed him to the emergency room, where his ECG showed signs of cardiac ischemia, reduced blood flow to his heart, and slightly elevated cardiac enzymes. He was admitted for observation and treated before things got worse. This isn't an isolated case. Pseudoephedrine can cause widespread blood vessel constriction, leading to sudden spikes in blood pressure, a serious concern for seniors with fragile arteries. It can trigger arrhythmias, palpitations, anxiety, and even myocardial infarction in people with underlying plaque buildup in their coronary arteries. It may also stimulate the nervous system, causing tremors, restlessness, or insomnia, especially troubling for older adults who are already sensitive to sleep disruption. What's worse is that pseudoephedrine often hides in plain sight. You may not even realize you're taking it. It's a key ingredient in dozens of non-prescription cold and flu medications, including familiar names like Tylenol cold, Panadol cold and flu, and Decalgen. It's also present in nasal sprays, sinus medications, and some allergy treatments. Now, I want to be clear, pseudoephedrine isn't a bad drug. For younger adults with no history of heart disease, when used short-term, it can be effective and safe. But for older adults, especially those with cardiovascular conditions, it's a different story entirely. If you have any of the following, you should steer clear of pseudoephedrine unless told otherwise by a doctor. Uncontrolled high blood pressure, coronary artery disease or prior stent placement, history of heart failure or fast heart rate, previous stroke or mini-stroke, irregular heartbeat or arrhythmia, taking heart medications like beta blockers, digoxin, or nitrates. There are safer alternatives to relieve nasal congestion and cold symptoms without risking your heart. You can use a facial steam or essential oils like peppermint or eucalyptus. They help soothe swollen nasal passages. Saline nasal sprays are another great option. They rinse away allergens and reduce mild swelling without any systemic effects. You might try non-stimulant antihistamines like loratadine or cetirizine. They won't raise your blood pressure. Raising the humidity in your bedroom or sleeping with your head elevated can ease nighttime nasal blockage and help you breathe more easily. And if medication truly is needed, ask your doctor or pharmacist for pseudoephedrine-free options, or at least something in a very low dose, used for the shortest time possible. Before you reach for a cold medicine again, ask yourself these questions. Do I know what's actually in the pills I'm taking when I have a cold? Have I ever felt my heart race or flutter after using a decongestant and just brushed it off as weather-related? Has someone in my family had a stroke or heart attack shortly after being sick, but nobody connected the dots? If any of this sounds familiar, speak up. Ask your doctor, ask your pharmacist, share your story in the comments because your experience could help protect hundreds of other seniors who are unknowingly putting their hearts at risk. Dear friends, today we've pulled back the curtain on a truth that's often overlooked, the fact that 6 common medications, even ones prescribed by your doctor, may quietly be putting your heart at risk, especially as we age. Some pills that seem harmless, even routine, can become dangerous when we're over 60. That's why regular review of your medications isn't just a good idea, it's essential. So now that you've watched this video, I invite you to pause and ask yourself, am I currently taking any of these medications? If the answer is yes, don't panic. You've already taken a powerful first step toward protecting your heart and living a longer, healthier life. And please, never hesitate to ask your doctor this simple but potentially life-saving question. Does this medication affect my heart in any way? Because sometimes asking that one question could save your life or the life of someone you love. If you found this video helpful, please tap the like button, share it with your loved ones, and subscribe to Age Stronger to join thousands of older adults who are learning to live smarter, stay healthier, and age with confidence. Thank you so much for watching. We'll see you in the next video. Stay safe, stay informed, and stay strong.